Well, actually in Victoria it's called the Bairnsdale ulcer, because it was first noticed down in the Latrobe Valley going towards Bairnsdale. And in fact most Australian cases are in coastal Victoria. It's a mycobacterium which is the same family as leprosy and tuberculosis. It causes a spot, and then an ulcer, which can be very difficult to treat, and using a combination of antibiotics and surgery. It's very common in some low-income countries, and where it is called Bouley ulcer rather than the Bairnsdale ulcer. And some people think that it might be spread by mosquitoes. You can certainly find it in other animals. There probably is an animal vector here, but other people have thought, well, you can just get it by going through the bush and picking it up from the vegetation. So it's not entirely understood how you catch it, but it can be really quite debilitating and it needs to be got on top of. And clearly has moved in from the country to the city.
Yeah, tuberculosis and leprosy are both really hard to treat because they're such slow-growing bacteria. Is it the same with the Buruli/Bairnsdale ulcer?
Yes. That's absolutely right. And it becomes what's called indolent.
That's such a great word.
The thing about indolent is that most antibiotics and treatments rely on fast-growing bacteria, which you can then attack and get into, whereas when it's slow-growing you don't have a kind of metabolic weak spot to get into it, and that's probably one of the reasons. They're just very difficult organisms to treat.
A very different kind of question from Helen, who says, should massage oil, like sweet almond oil that's applied to the skin, be absorbed and counted as calories? In other words, if Helen is being mindful of her energy intake, does oil on the skin count?
You know, I've often wondered that. I had a look for it and I don't think anybody actually really knows. It's certainly true that you absorb oil that you rub into the skin. That will get into your bloodstream, and if it's metabolizable, then it will be transferred to calories. But a lot of it will be trapped in the outer layers of the skin, which blood doesn't get to. How much actually gets into the body is probably quite limited, so if that makes you feel better, I don't think there's a direct relationship between obesity and massage.
Right. Anne's asking about, her elderly aunt has rheumatoid arthritis in her hip and she's in a lot of pain. And the specialist has mentioned something called platelet-enhanced plasma that would be injected as an option. Have we looked at this before, and what does the evidence say about this?
Let's back up a little bit with things that you inject into the joints. There are various things you can inject into joints when you've got osteoarthritis that can make you feel better. A lot of doctors now would not advise injecting steroids. There is a substance which is a bit like the filler you put in your lips, hyaluronic acid, which you can put into the joint, which helps to lubricate it and lasts maybe for about 3 months, but has only limited value. There was a trend there for a while of injecting stem cells into the joint, and it got some improvement. But in fact what they found was that when you did placebo trials or studies of the stem cells, it wasn't the stem cells, it was the fact that you were irritating the joint and causing a bit of bleeding that actually caused the pain relief. Well, why don't we just inject blood products, like platelets? So you take the blood and you spin it right down and you reinject it back into the joint. And apparently it does work. It does relieve pain for a while in osteoarthritis. I'm not aware that you would take the risk with rheumatoid arthritis, or that good studies have been done. But there is some evidence that it works in osteoarthritis. It's pretty major, and if you've got a joint, let's say that you've got a sore knee and you've got osteoarthritis of the knee, and you want to try and delay a knee replacement, certainly what you don't is an arthroscopy with a clearing out, because that can speed your progress to needing a knee replacement. Something like this might help you delay it. I really do think that you need to talk to your rheumatologist about it if you've got rheumatoid, because rheumatoid is an immune response to the lining of the joint, and you don't want to actually play with that too much. But in terms of delaying knee replacement, strengthen your quadriceps, physiotherapy, hydrotherapy, those sorts of things, same sort of things as for osteoarthritis of the hips, can delay it, and in fact can take some people off the waiting list altogether. So there are things that you do that don't require an injection to the joint. But anecdotally, some people do get a benefit from platelet-enhanced injections.
And one last question from Richard, who's talking about a friend of his, a young woman who's recovering from anorexia and has some mental health issues, which is sort of beside the point. The question that Richard is asking is, antipsychotic medications. He's noticed in a few friends of his who've had it, they've had big weight gain after being put on antipsychotics. And he's wondering why this could be.
It's a major problem with antipsychotic medications, and it's why some people with schizophrenia don't like taking them, because they do put on weight and you can increase the risk of type 2 diabetes, so there are major side effects. And there hasn't been enough research yet into antipsychotics which don't do this. Some of them have a lower risk of that than others, and if you want to minimize the chance of weight gain, you need to talk to your psychiatrist about which one might be best for you. Also, if you do exercise, and there are some other drugs that you can take with them, like metformin, which can mitigate the weight gain. The reason for the weight gain is not entirely clear, but from animal research it suggests that the antipsychotics do affect a receptor in the brain which increases appetite, at least in animal models, and decreases activity. So these antipsychotics work by influencing neural receptors in the brain, chemical messengers that are not that targeted, and one of the side effects is that it's obviously affecting the appetite center, and perhaps even the desire to take exercise.
Right, so interesting. Well, that's all we've got for you in our mailbag tonight.
And we'll see you next time.
See you then.